And today we'll talk about the heart failure, the pathology. Now, there are a number of compensatory mechanisms that the body set off when it sees heart failure. Remember, I mentioned them just a few moments ago. What are the compensatory mechanisms? Well, let's think. Why would the body compensate for decreased cardiac output, for decreased pumping of the blood? The reason the body compensates is because it interprets heart failure as if there has been hemorrhage, as blood loss, a dehydration, in other words, the reduced pumping ability. The body interprets as, oh, there are lack of blood from the hemorrhage, or there are lack of fluid in the circulation because of dehydration. And instead of whole bunch of the compensatory mechanism armored holding on to fluid, water, and salt. Unfortunately, this is exactly the opposite of what we would want, because in holding on to fluid, you actually create the setting where patients put some of that fluid into the tissues, put in the leg as edema, or in the lung as pulmonary edema. So the activation of the neurohumoral system, thus central nervous system, initiated activity to correct the heart failure situation, actually make the situation worse. These systems work great if there dehydration, you are cough in the desert without water. They work great if there are hemorrhage. You have been cut somewhere on your bleeding from an ulcer in your stomach, but they work unfortunately in the negative manner in the patients with heart failure. Let's just talk a moment about why these compensatory mechanisms work. They work because of something I mentioned before, Starling law, the so-called rubber band law of the heart. The more you feel it, the more it contracts. So what is the compensatory mechanism of trying to do to increase the feeling of the heart? So it will squeeze more. As I've said, unfortunately, that leads to elevated pressure that's back up in the system and result in edema. But the rubber band law of the heart says that the force on contraction is related to how much you strengthen the heart muscle cell, and this increase contractility. So you see why the body trying to increase the pumping ability of the heart, and this works fine. It is a hemorrhage or dehydration, but it doesn't work well when the heart patient has a heart failure. So remember, stroke volume of the number is the number of cubic centimeter. Okay, repeat. So remember, stroke volume is the number of cubic centimeter that the heart put out with the time of squeeze time heart rate. That's cardiac output. So when we have reduction in stroke volume because of the heart has been injured, Sometimes you have seen the heart rate going up because of the central nervous system say, oh, cardiac output is falling. We have to increase the heart rate. We have increased our ability to hold on the salt and water and increase the blood volume and use the starting law to increase the contractility of the heart. Again, unfortunately, it's not the right setting for that, and this leads to overfilling of the circulation, increase the pressures in the circulation, and increase fluid getting out into the lung and into the tissues. So the central factor in the heart failure, of course, is depression of the heart muscle, at least for systolic heart failure, but also in diastolic heart failure. The heart is supposed to actively relax, and there are also depression thus. But the commonest form of the heart failure, as you have seen in the previous slide, was systolic. And it's usually because of the been injury to the heart muscles, most commonly from ischemic or coronary artery disease with heart attacks. And again, we're talking about the compensatory mechanism. Here are the compensatory mechanism list here. First of all, they are initiated by the central nervous system. One of them is the signal that sent to the kidney, and that the kidney actually dies on its own. The kidney is regulator of the blood pressure in the body. It's seen a drop in blood pressure, a drop in cardiac output, and release compound in something called the renin. I'm not sure. Renin. Angiotensin system, which hold on to salt and water, is a hormone that actively tell the kidney, hey, don't pee out sodium and water. Hold on is because the circulatory system needs some volume. There are also hormones that are released from the pituitary, so-called antidiuretic hormone, when tell the kidney, hey, hold on the water, don't let the water go out in the urine. In addition, you also have the activation of the sympathetic nervous system, which is part of the flight or fight system. This sends to adrenaline into the heart muscle to try and get into the contract more vigorously, contract more, and it also clamp down a little bit on the periphery in the attempt to shrink the volume, and the heart may also pump into. All of these compensatory mechanisms you can see the work rate if you're talking about the dehydration or hemorrhage, but they work in the wrong direction when the patient already has a depression left ventricular. The other thing that's happened is that the heart muscle remodeler. It reconstructs itself, if you will. You can see in the diagram on the left, there one form of remodeling, left ventricular hypertrophy, where the ventricle markedly thicken, for example with aortic stenosis. we're talking about the patients in the last lecture. On the other side shot of the thing you see in a cardiomyopathy, the heart dilate, thicken a little bit, but predominantly what it does is dilate. And you have all heard someone say, oh, so and so in the trouble, they have a big heart. That's because the heart dilate. That's often the final state of the heart failure. When the heart has a short, all of its other compensatory mechanisms to get the cardiac output up, then you start to see the dilation of the left ventricle. Now again.